Hello and welcome to Unstress. I am Dr Ron Ehrlich. Do you know, if you don't eat for a few weeks, you will probably eventually die, and if you don't drink for a few days, there's a good chance you will as well. But it only takes 5-10 minutes at the very most. Most people wouldn't go more than 3 or 4 of breathing before you stop breathing and are dead. So, breathing is without a doubt one of the most important functions we perform, and we do it from the moment we are born to the moment we die. And we know that the secret to good health is to keep breathing for as long, well, the secret to a long life is to keep breathing for as long as you can, but the secret to a healthy long life is to breathe well for as long as you can. And what does that actually mean? Well, my guest today is Dr Rosalba Courtney, and she is an osteopath who, after many years, let's just say over 30 years of clinical practice, thought, well, what was the most important thing she could learn to improve the health of her patients? So guess what? She did a PhD about 7 or 8 years ago on dysfunctional breathing. What is it? How do you measure it? What's the clinical significance, meaning what's the everyday significance? And now these actually are questions after almost 40 years of dental practice that I also thought was worth asking too. I include a chapter on breathing in my book, but we go into quite a lot of detail here. And if you think noses are just that thing on the front of your face to separate your two eyes, well, actually there are over 30 functions of the nose, and we don't go into all of them, but we go into quite a few of them. And if you think breathing is just about oxygen, well, no, it's not. There's a whole lot more to it than that. So there's an awful lot we go through here. I thought it was a great conversation. I hope you do too. This is my conversation with Dr Rosalba Courtney. Welcome to the show, Rosalba.
Oh, good morning, Ron. Thank you.
Rosalba, we're talking about breathing today, obviously, and people kind of take it for granted. Can I just start from a really basic point, and that is, why do we breathe?
Well, breathing is our most important function in that you can't go very long without breathing.
Yeah, no, got that. Yep.
So, probably the primary purpose of breathing is exchange of oxygen and carbon dioxide so that you have oxygen for energy. But there's a lot more to breathing. Breathing has lots of different functions that many people are unaware of. They go beyond just the exchange of those gases.
I thought there were, and that was the lead in, because
yes, of course.
Because we know that if you don't eat, you could live for a few weeks, and if you don't drink, you could live for a few days. But breathing, you've got how long have you got before you're gone? Breathing.
Well, it's not very long. Some people, the records for breath holding are getting longer and longer, and I think people have gone, some of the records are 10 minutes. I've even heard about 20 minutes, but most of us couldn't go longer than, say, 5 minutes, and that would be it. Yeah, so it's really fascinating. So the kind of chemical side of breathing, which is the regulation of oxygen and carbon dioxide, there's another aspect to that which is really important that a lot of people aren't aware of, which is that breathing is one of the major regulators of pH, of acidity and alkalinity. And your lungs work together with your kidneys to regulate pH. So pH, of course, being fundamental to, metabolic activity and creates the environment for different chemical reactions to go smoothly or not in the body. So pH is very important.
A lot of people would be aware of that acid-alkaline thing and try to correct it nutritionally, and that is a good way to do it, obviously. And some even drink alkaline water, which I personally have a few problems with. But tell us about how breathing balances out the pH.
Well, if we talk about, say, dysfunctional breathing, if someone's been overly stressed or, life's challenges have just been too great, or, there are different sorts of stresses. But if the body's been stressed, often the response of the body is to increase its breathing, to increase its ventilation. And if you increase your ventilation too much over too long a period of time, your body ends up becoming depleted in bicarbonate. And bicarbonate being your major regulating system within your body. It's sort of a bit of a trajectory to get there. Like when you overbreathe, first of all, you blow off carbon dioxide, so the body becomes alkaline. But within a short period of time, your kidneys try to balance that out by excreting bicarbonate. And if you keep overbreathing and getting low in CO2, and then your kidneys have to excrete bicarbonate to balance that, then over time you lose the most important buffering mechanism in your body, which is around bicarbonate. So no matter what you eat, you just can't buffer, the acidity that happens just as normal energy metabolism. And so you end up with a sort of a chronic cellular acidity that your body can't balance. So the inside of the cell becomes acid, and the response, or the byproduct of that is just that the cellular energy production is affected and general health is affected in lots of different ways. When your body excretes bicarbonate, it takes other minerals with it, like, for example, magnesium, potassium, sodium. So the effects are quite far-reaching just on that biochemical level with breathing.
People do think about breathing as being about oxygen exchange, so you breathe in oxygen and that attaches onto hemoglobin and then it gets transported around the body. But the transfer of that oxygen at a cellular level requires a really narrow pH level, doesn't it? I mean, that's part of the issue.
Yes. That's right. So breathing more doesn't necessarily give you more oxygen, because if you overbreathe, what happens is that you blow off too much CO2. And if you blow off too much CO2, then the red blood cell doesn't release the oxygen to the cell. So breathing more can end up, if you're overbreathing, can end up giving you less oxygen available to the cell. If you combine that with abnormal pH inside the cell, then you see how stress and overbreathing lead to, a whole range of health problems.
It's interesting, isn't it, that nutritionally stress means that your blood supply and your digestive tract isn't working as well as it should. So you could be on a fantastic diet, but under stress you may not be absorbing your nutrients. Similarly, you could be on a great diet, but if your breathing is out of balance and your pH is out of balance, then that oxygen is just not going to get to where it's needed.
Yeah, so true. And the metabolism in the cell isn't quite as it should be. So breathing becomes this thing that you need to look at. It's so commonly ignored. They say that probably 1 in 10 people has this overbreathing issue, to the point that you can measure it. You can measure their carbon dioxide and see that it's low. And yet mostly that's overlooked because people don't measure it. You have to actually have someone look at the, carbon dioxide levels in the exhaled nasal air, and you'll see that the levels are low only when you measure. But there are, other ways that you can see it. If people are feeling, when there's unexplained breathlessness, that can be one symptom that the breathing is dysfunctional.
Mm-hmm. Yeah, and I mean, there's a whole list, really, isn't it? I mean, you have done your PhD on this, dysfunctional breathing issue. It's obviously a very, very big problem. I mean...
Yeah, it's a fascinating topic. It's really a fascinating topic, and I spent 8 years doing that PhD, and I didn't run out of interesting things to learn in that time, and I'm still learning more and more about it. But I'm sort of convinced that breathing is really one of the fundamental things for health, and commonly disturbed, often overlooked, and it can be fixed. You can actually work with breathing and use it as a healing tool.
How long does it take for dysfunctional breathing to really start to make a difference clinically? I mean, is it a matter of hours, days, weeks, months, or years? What sort of time frame do you think before these kind of symptoms appear?
Right. Oh, that's a very interesting question, Ron. I'm not even sure I know the answer to that.
That's okay.
I would think the way that I measure dysfunctional breathing would be looking at symptoms. I look at carbon dioxide, and then I look at breathing pattern. And often I'll find different levels of dysfunctional breathing and different types of dysfunctional breathing in people. But people vary in the symptoms that they have from that. Do you know what I mean? Some people seem to have a resilience, they can cope with their breathing not being optimal, and they don't necessarily have heaps of symptoms, and they don't show aggravation of different disease states. So I think it's sort of one factor that sits in amongst other factors. So
when we talk about dysfunctional breathing, we probably should really go back one step further and say, what is ideal breathing? I mean, how do we, let's define what a really well-balanced breathing is.
Right. Well, it depends on the person and the circumstances. So I've actually got a definition of functional breathing, which is that functional breathing is breathing that performs its primary and secondary functions, and it's efficient, adaptive, appropriate, and responsive.
Okay. Break that down for me, please, Rosalba. Primary function. Okay, let's go to the primary functions first, and we'll get to the secondary functions.
Okay.
Yep.
So
you've already mentioned it's the exchange of oxygen and carbon dioxide.
Yep. Then, so breathing is also a pumping mechanism. It pumps air, but also it creates pressure changes in the body that influence blood flow and the flow of lymph, and creates different pressures that drive fluids around the body. So it's got a pumping action. So you can think of it as a kind of a biomechanical pump, as well as, so you've got the biochemical side, which is the oxygen, carbon dioxide, and pH. And then you've got this biomechanical side where breathing is acting like a pump. But then breathing also interacts with lots of other systems in the body. So that would be its secondary functions. So breathing interacts with the mechanisms of voice production, speech and vocalization. And breathing also has psychophysiological functions. So it's the way that people calm themselves or change and regulate their mental, emotional state and their level of arousal. So that's a secondary function of breathing. And another secondary function of breathing might be that it's a rhythm, it's an oscillating rhythm that influences homeostasis and the function of the autonomic nervous system. So I could go on, but they're the kind of things. So, breathing is really at the center of body function, because almost every system in the body influences breathing, but breathing influences lots of other systems in the body. So the digestive system, the lymphatic system, the circulatory system, the body's blood pressure regulating system, and so on.
Yeah. So we talk about over-breathing, but what's the range of optimal breaths per minute, say?
Yeah. Well, that's where the appropriate thing comes in. If you're breathing and you're at rest and calm, then the optimal speed of breathing for someone in their normal everyday state might be somewhere between, 9 to 15 breaths per minute. Mm-hmm. But if you're breathing to put yourself into an ultra calm state and create optimal interaction between your breathing and your blood pressure mechanism and your heart rate and your autonomic nervous system, you'd probably breathe 6 breaths per minute.
So there's something quite appealing to me when I hear you list out all those things, like getting the best out of our circulatory system, our nervous system, and that optimal. So ideally we should be breathing slower, depending on the stress and what activity we're doing.
Yeah, exactly. The way I view it is that I think that you've got to just live your life, and if you're trying to always breathe at 6 breaths per minute, then you might miss out on some fun things in life, Mm-hmm. And also it would be a bit artificial and forced. Yeah. But it's really good to have times during the day where you go to that optimal state. Yeah. So we need to go there. And people have always done things to take them there. For example, certain types of poetry, like the type of poetry that was done in the oral tradition, the Iliad and the Odyssey and those poems that storytellers went around to villages telling people. And people would sit and listen for hours while the storyteller told this story in verse, and it would be kind of rhythmic, and he would have to, or she would have to breathe at, around 6 breaths per minute, and the listeners would entrain into that zone. And also, hymns and rosary prayer and certain types of music and children's nursery rhymes tend to get people breathing at about that rhythm. So when you meditate, if you're focusing on your breath and really just relaxing and tuning right in, most people will tend to get to around that 6 breaths per minute type of breathing. So it's a lovely place to go to renew, restore, and rebalance yourself, really.
And so the rate of breathing is important. Now, whether one of these topics that the more I learn about nasal breathing versus mouth breathing, the more amazed I am by how important that is. Can you talk to us a little bit about the difference between mouth breathing and nasal breathing?
Oh, yes. So some people say the nose was made for breathing and the mouth was made for eating and talking. And if you breathe through your mouth, then you should eat through your nose.
Interesting thought. Don't try that at home, please.
Story that people say sometimes just to sort of say, look, see how ridiculous it is to breathe through your mouth. But the nose has many, many functions, maybe 30 different functions.
Wow.
And if you breathe through your mouth, you don't get those functions. So your nose, you know a lot of these, Ron.
I do, but my listeners might not. So let's assume I know nothing.
So your nose, first of all, it cleans and filters the air, which the mouth doesn't do. So your nose has lots of mechanisms for filtering large and small particles. And it also has immune effects, so it can kill certain viruses, bacteria, and even fungi using, lysosomes and a substance that it produces called nitric oxide. So your nose is a real cleaner of the air that protects the airway, really, and really the throat from, these things that are in the air, particulate matter and organisms that can assault our lungs and our immune system. And your nose also, it's a resonating chamber for the voice, so it's important for creating certain qualities of voice. And your nose, very involved in smell, but there's an alternating function where your nose alternates, opening and closing one side more than the other, which seems to have brain and nervous system regulating effects. And your nose actually communicates with the brain. There's some recent research showing that nasal breathing actually affects the brain so that the brain starts to oscillate at the same rhythm of breathing. And nasal breathing seems to improve memory and learning functions of the brain. And when you breathe through your mouth, you don't get that effect. So breathing through your nose has a sort of a calming, mind-clearing effect. And, children who mouth breathe, for example, will have learning and behavioural issues. Your nose also is important for regulation of breathing. So when you breathe through your nose, it makes your diaphragm work better, gives you a better breathing pattern. And it's involved in reflexes that help to open the throat, the pharynx. So it's important for things like snoring and sleep apnea to breathe through your nose. And let me see, what else is there?
Wow. I mean, it's fantastic. You mentioned about communication with the brain, and I think I did read that bit of research about empathy. There's a part of the brain called the amygdala, and it was a fascinating piece of research. And is that what you're referring to? Like that people who breathe through their nose seem to be more empathetic.
Oh, I don't even know about that.
I'll have to send you the.
Please do. That sounds very interesting.
But what about the diaphragm? Well, no, what was that? You said communicate with the brain, and that I think that's Maybe we can put in the reference later. I'll send it to you. Yeah,
and you might want to put it at the end of the podcast.
I would.
But it's a really complex bit of research where it had several layers to it, but they looked at people who were having severe seizures and they did some analysis of those people, and then they also did some animal studies. But what they were able to show is that nasal breathing really affects those parts of the brain that are involved in memory and learning in the limbic system, which are also have to do with emotional regulation. So there's a link, there is a link there with emotional regulation. But this whole thing about smell and connection and memory and empathy, there's interesting stuff there too.
You also mentioned the diaphragm, which is another part of breathing optimally, if you like.
That's right.
Tell us about, a lot of people don't use their diaphragm. And you're an osteopath. Now, this is what's so interesting. I've mentioned this in our intro, but you know, here you are, an osteopath with clinical years and years. I won't go into how many years. Many years of clinical experience, and you go off and do this PhD in breathing. But the diaphragm. Tell us about the diaphragm.
Well, the diaphragm's our most important respiratory muscle. A lot of people don't get how huge it is. You know, you can't see it. It sits inside your body, and it separates the abdominal cavity from the rib cage. And when you breathe in, your diaphragm descends and flattens, and it goes down, you know, into the abdominal area. It presses on the abdominal contents, and it makes more space inside the chest cavity so that the pressure inside your chest cavity drops and air can come in. So it regulates the pressure changes that allow you to breathe. And it works with other respiratory muscles, you know, to make that happen. You know, the nerve to the diaphragm is called the phrenic nerve, and the root of the word phren means mind. And when people are stressed and anxious, the diaphragm can actually get overstimulated, and it goes into a sort of a spasm, if you like. So it descends and flattens and gets too tight. So people go to breathe, and the diaphragm isn't working very well, so then they start to use their chest muscles and their shoulder muscles to breathe. And they can't, you know, really get an effective diaphragm action. So diaphragm breathing, a lot of people think that diaphragm breathing means pushing your belly in and out, which it's not. You know, some belly motion can help your diaphragm to work. And certainly people should be able to breathe in this lovely 360 ring, you know, where when they breathe in, the lateral rib cage expands sideways and the front and back of your body also move outwards, so that the lower ring of the lower rib cage and abdomen increases its dimensions as you breathe in and decreases its dimensions as you breathe out. But the thing is that many people try and diaphragm breathe by pushing their belly in and out, and sometimes that's counterproductive. They can't do it. It stresses them out. So I spend a lot of time just training people to just slow and relax your breath, focus on the exhale, and just give yourself time. Make your breathing low, slow, and soft, and then gradually the diaphragm starts to breathe better.
I think we've just had a bit of a retraining program just with that. I was just breathing as you called it.
That's good. I hope that worked for you.
It's good. It's feeling good. But the other thing about using the diaphragm also is, I mean, if breathing is about gaseous exchange in our lungs, it's nice to be able to use as much of our lungs as possible, isn't it?
Yeah. Again, it depends on if you've got someone who's really already hyperventilating and overbreathing, and they just try and always breathe big breaths in the belief that that's always going to be better, it can actually work against them. So it is a matter of appropriateness. So I often say to people, look, if you don't know what to do with breathing, just always think, relax. The big thing about breathing is that people who are stressed will, you know, a little bit overbreathe and tend to use their upper rib cage and chest. So breathing a little more slowly and making the breath low and soft will usually put you in the right zone.
And I guess also the fact that this sheath of muscle separating the abdomen from the respiratory system also has this massaging effect too, which is kind of, it's cool. Imagine being able to massage your organs. That's
right. Yeah, it helps to kind of pump the liver and help the lymph to flow, and it can regulate peristaltic activity in the gut. Some people with reflux and irritable bowel syndrome actually find that they get good improvement in those gut symptoms by learning to do proper, you know, good, relaxed, slow, soft diaphragmatic breathing.
Now,
And there are a few research studies on that.
yeah. Now you've mentioned, and I've heard you say this, and I remember last time I heard you give a lecture, which was fabulous, I have to say. You mentioned nitric oxide, and you've mentioned it again today. Tell us, because people know about oxygen, more or less, and they kind of know about carbon dioxide, but nitric oxide is something quite exceptional. Can you tell us a little bit about nitric oxide?
Yes, I'm glad you emphasised the ick.
Well, nitrous is one we use in the dental practice, and
exactly.
It's a very different.
Sometimes people get it muddled up, don't they?
They do.
And they go, "Oh yeah, nitrous oxide. I heard about that. Isn't that stuff you breathe out of balloons that makes you act silly, or something?"
Yeah.
But yeah, nitric oxide. Nitric oxide, or N and O, one nitrogen, one oxygen, and it's produced in a number of places in your body. It's produced in, blood vessels and from some epithelial tissue. But apparently, this is what I've read, that 60% is produced in the paranasal sinuses. So breathing through the nose is important for that local nasal nitric oxide production. And nitric oxide is such a fascinating chemical. The research that was done in the early, 2000 era identified that there were 2,000 functions for nitric oxide. So one of the interesting things about nitric oxide is that it's actually involved in oxygen transport, and it sort of dilates things. It dilates blood vessels. It opens blood vessels up, and so it can help, what's called perfusion, blood flow in different parts of the body, including the brain. And people know, that nitric oxide dilates blood vessels. So things that cause nitric oxide to break down can make blood vessels constrict a little bit. And if you stop the breakdown of nitric oxide, you can get better, blood flow. So, for example, the drug Viagra, stops the breakdown of nitric oxide. That helps people remember what nitric oxide does.
Yeah, that's got half the audience's attention, or maybe the whole audience.
There you go, as soon as you mention that word.
That's right. But it's interesting, isn't it? You're saying this research was done in the early 2000s. So the whole work on this nitric oxide is relatively new.
Yes, I guess so. I was thinking it was old, but I guess, yes, it is relatively new. But nitric oxide, it's a complicated, interesting chemical. Tissues that are inflamed will make more nitric oxide. But then again, nitric oxide, it's all about nitric oxide regulation. So you don't want too much, you don't want too little. And breathing nasally probably helps in nitric oxide regulation in the body. So nitric oxide is known to be a dilator of the bronchi, for example. So some people feel that it might have a role to play in helping keep the airways open in people with asthma. Although, people with asthma and inflamed lungs sometimes have higher levels. So it's just an interesting and complex chemical.
And you also mentioned it being antimicrobial as well, which would be pretty important in the airway, I guess.
Yeah, so you can see how the body maybe uses nitric. The body has an amazing intelligence, so it's making more nitric oxide maybe when it needs it. But when we get into bad habits like mouth breathing or over breathing, we might lead to disturbance of that nitric oxide regulation in our body. And it's known that nitric oxide is a neurotransmitter that regulates memory and learning. It seems to have a role in relaxing the gut, in irritable bowel syndrome. And so on. So it's a fascinating thing. So breathe through your nose to have proper nitric oxide regulation.
Because one of the things that always surprises me is when I asked a mouth breather, we've got a blocked nose, and we maybe put some micropore tape on the mouth and ask them to just calm down and breathe slowly. Suddenly a nose that is blocked is unblocked. And it's a kind of a paradox, isn't it?
I know, it's quite amazing, isn't it? Yeah, because there are some people where conscious, voluntary nasal breathing actually can retrain the nose to work better. And that's certainly something I've had experience with over 30 years. And there are some people where that doesn't work. They make this effort to breathe through their nose and they just get more and more distressed. And so those people often need to see an ear, nose and throat doctor and get a proper diagnosis, because they're usually very obstructed and they can't retrain nasal function. But there is this subgroup of people who, I don't know what percentage of people it is, but where consciously making the effort to close their lips, breathe through their nose, and really doing it during all activities of daily life, including exercise and also sleep, makes their nose start to work better and better. And we so desperately need research about this, because there are many, many people around the world who are telling people to tape their mouths and breathe through their nose, and then there are other people saying this is not a good idea, you shouldn't do it. And the reality is that it seems to really work for some people, and we just need some research about it to show how it works to decrease nasal resistance, because, empirically this seems to be the case.
Now, I actually did see a piece of research which showed that putting tape on reduced the incidence of apnea and hypopnea. Now, apnea, as our listener may or may not know, is when you stop breathing while you're asleep, and hypopnea is when you've got a restricted breathing. And it actually reduced it. So I found a bit of research that actually did... I'll send it to you, and I'll put it on our website.
Please.
But listen, we have talked on this podcast a lot about sleep. I think it's the most important part of the day. And it's a question of quantity, how much you sleep, but quality being the breathing aspect of sleep. And there are CPAPs and mandibular advancement splints. But I know you've just recently written a great blog post, and we're going to have links to your website, on our podcast here. And you said that there are some self-help measures that you can do in breathing, retraining and throat exercises that could be helpful. Can you tell us about those?
Yeah, sure. Yeah, because a lot of people feel that, think that the only option with sleep apnea is to, make a bigger airway. So with CPAP being the gold standard treatment and mandibular advancement splints being also accepted therapy. And they do work for a lot of people, and I wouldn't discourage people using them when they need them.
Just remind our listener what the CPAP stands for, just in
CPAP
case they've
stands
tuned in.
for continuous positive airway pressure. So it's using air pressure delivered through a mask to splint open the airway at night.
And a mandibular advancement splint is bringing the jaw forward and the tongue's attached to the lower jaw, and so it doesn't fall back and block the airway. But there is compliance issues and expenses with both of those. But I love the fact that you're offering some alternative that could be helpful or supportive. Yeah,
exactly. Alternative or supportive. Supportive being really probably something that I'd like to emphasize, because the thing is that with mandibular advancement, I'm sure you would agree, Ron, it's like you want to be able to, bring the airway forward, but the more you have to bring it forward, the more likely it might be to give jaw issues. Would that be right?
Yeah. And look, we'll do a whole program on that, because if you've got a clicking jaw, there's things you need to be careful with. But anyway, but I'm more...
And with CPAP, you want to be able to use the lowest pressure that you can get away with, that still gives you the decent sleep. There's a whole body of research starting to develop about using functional measures, using things that improve the function of breathing and the function of the airway that can support people with sleep apnea and help them get better results, with CPAP or mandibular advancement. And in some cases where people just can't tolerate those therapies at all, they can actually on their own give really good improvement. And the rationale or the theory behind it is that people can have sleep apnea because of these functional issues. And the functional issues are things like, neural input to the upper airway muscles. So there are some nerves that sometimes aren't communicating very well with the airway. So the airway muscles aren't responding well and keeping the airway open during sleep. And there's another important thing, which is just the stability of breathing control. So it's something called loop gain. And if people have low CO2 and their pH is all out of whack, they're going to be more likely to have unstable breathing, and that will be something that can contribute to sleep apnea at night. Many years ago, when I was helping people with asthma, with breathing retraining, we started to find that people with sleep apnea were coming back and saying, hey, I just had another sleep study done and it's really improved. I wasn't able to use the CPAP, but I've done these breathing exercises and actually my sleep apnea is better, in some cases completely better. And at first I didn't really believe it. But the more I looked into it, the more I was finding research studies showing, possible mechanisms, but also showing that certain therapies were helping. So one of the interesting studies is about Didgeridoo Playing.
Yes, I've heard about this.
Yeah, it was actually published in the British Medical Journal. And they had people over 3 months do about 2.5 hours of Didgeridoo playing a day.
Wow, that's commitment.
Yeah, and they found that they had like a 30-40% reduction in apnea, hypopnea incidence. So also there have been studies just done with, diaphragm breathing, retraining, and some studies done showing that people who play double reed wind instruments or who play in orchestras, that they have much less sleep apnea. And there have been a number of studies done with throat exercises, throat and tongue exercises, showing that people can get, 50% reduction of their sleep apnea symptoms.
Well, you've used that word functional methods, and it's so interesting to hear that used in this context because, gymnasiums now, who I think are tuned into what one should really be doing, are talking about functional movements in their workouts. I know the gym that I go to, and Aaron McKenzie, who is my inspiration for movement and exercise, talks about functional movements. And here you are using this term because if your breathing has been dysfunctional for a long time, or if you've been overweight and now you've lost weight, the tone of the muscle is still not there. And so we need to turn what was dysfunctional into functional. I love that term.
Yeah, it's a great term, isn't it?
Yeah.
It's just saying, making something function better. And to make something function better, you have to train it, just like exercise training. So breathing exercises can be a type of training that improve the function of breathing. Yeah. And throat and tongue and swallowing exercises can train the function, of those structures of the throat. So that's the point. As an osteopath, the primary thing that osteopathy is based on is that you need to influence structure and function. So I'm always interested in seeing how the structure-function equation works in all different conditions. And I'm a strong believer in taking care of structure, but also not ignoring function.
Now, I'm going to ask you about leaving our listener with some tips, but here's a question that I've asked almost everybody that I've interviewed, and it's fascinating to hear people's response, particularly because you've been you've been a clinician seeing patients for quite a few years now. You've been in practice for how many years, Rosalba? Go on, tell us.
Oh, okay. Look,
Here it is. I'll tell you. I'll tell you if you tell me.
Oh well, since the late 70s. So what's that?
Yeah, it's a few years. Okay, I'll let them listen. I'll let them work that one out. But listen, in your experience, what do you think the biggest challenge is for people in our modern world on their journey to having good health, to enjoying good health? What do you think the biggest challenge is for people?
Yeah, I think, the biggest challenge, well, I'm going to say breathing and airway.
Okay. Well, I would have expected nothing less.
I'm just going to throw that one into the ring.
Yeah, okay, that's fine.
Breathing and airway, think about that. It's so fundamental. I spend my days thinking about those things and helping people to improve those things and seeing great outcomes from them. So, no one else, not enough people talk about them. So I'm just going to throw that one in.
Which leaves us with the last few tips. So if people were sitting here thinking, okay, I'm on board now, I recognise that breathing is something I haven't given much thought to, but here I am. What do you say to them as they start before they come and attend a breathing retraining program somewhere?
Yeah, I would say, if you're breathing through your mouth, take care of that, first of all, and just become aware of your breathing. And if you're noticing that your breathing is excessively irregular or that you're breathing often, too quickly and breathing using your chest and shoulders, then your breathing is probably too amped up. You're probably reflecting your general stress within your breathing mechanism, and just take a step back. Breathe through your nose. Breathe low, slow, and soft. And if working to do that doesn't help you, then get yourself investigated a little bit further. And don't forget about the airway. If you haven't had a sleep study, 80% of people with severe sleep apnea are undiagnosed. And sleep and breathing are so important. So it's very, very important to know how you breathe at night. If you're snoring, do something about it. Don't ignore it. It's not just something that's cute or funny. It's really important that you do something about it. Have a sleep study, get it checked out.
Great. Thank you so much. It's been terrific talking to you, Rosalba, and I'm going to have links to your webpage, and we'll have some of those articles up on our website.
Oh, thank you very much, Ron. Thank you so much. Bye-bye.
Bye. Wow, so much to think about, so much to cover there. We really covered some territory, and I came away from that thinking, well, breathing is really about regulation. It's regulating our body chemistry. It's providing us with a filtration system if we're doing it well. It's providing us with an internal massage system through our diaphragm if we're doing it well. But it's not just about regulation, it's about building resilience. And actually, that's the theme of this podcast, my book, and that is to take control of your own health, to build physical, mental, and emotional resilience to deal with the stresses of life. So breathing is just so fundamental. Now, we mentioned a couple of research articles there. We'll have links to them on the webpage. I'll have links to Rosalba's webpage on our webpage as well. If you're a health practitioner or if you're a member of the public and you want to just do some breathing retraining courses, Rosalba is so well placed to provide that. Not connected to any one school of thought, a very open mind, a really informed open mind there. So we'll have links to that. And if you've just joined our podcast and you're wondering what it's all about, go back and have a listen to episode 1. I particularly made that a short mission statement to kind of calibrate and focus you. Otherwise, go on to our Facebook page and leave us some comments or some suggestions. I hope you enjoyed it. Until next week, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.